Hey, Dr. Shakib here from Irvine Spinal Wellness Center, your Irvine Posture, Chiropractic and Wellness Clinic. Let's talk about the proper way of sitting with regards to your lower back, so stay tuned. All right, so what's the right way to sit? I can tell you that crossing your legs, even though we're so used to it, is not the best pelvis and lower back friendly position. So I discourage you to do that. If you're used to it like I am, catch yourself so you correct it. And then we've got some guys that sit like this, and what ends up happening is they really put themselves at a disadvantage with regards to the pelvic floor and also the positioning of your femur, this thigh bone inside the socket, which is part of your pelvis. So it really, you want to have a position that the least imposition on the joint is when the joint is at a neutral position. That means if this thigh bone has a ball at the end and the pelvis bone has a socket to hold the ball, which is the case, we don't want to bring this ball inside the socket to the front, to the back, to the top, or too far to the bottom. So you want to make sure it's centrated. So when you sit like that, you're actually externally rotating this, you're turning it out, and it's closer there. It's really jamming in the back of your socket. When you're crossing the leg, it's a similar situation, only in the opposite direction, and it twists your pelvis. Your pelvis bone is not just one bone, but it's actually 3 sections to it. It's one half, the other half, and the 2 halves meet the sacrum in the middle. So when you're crossing your legs one way or another, you're really twisting the 2 halves, and the body's able to do it, but when you are doing it on a regular basis, it causes more tension in the ligaments, in the musculature in that area. Proper way of sitting with regards to pelvis and the lower extremities is really to be having your knees as wide apart as your pelvis with your ankles at a 90-degree position. When people cross their legs and sit like that, that's a lot of torsion and stretching of the ligaments on the inside of your knees, which is not good, and same with the ankles. Sitting like this, which I just got the cue from my wonderful videographer back there, when you sit like that, it's definitely twisting and imposition in the hip joint and the knee joint. So keep that in mind. The little things you do throughout the day make a huge difference when you add them up day in, day out. Thanks for watching. Make sure you subscribe to my YouTube channel and check out my website where you can also contact for your appointments. See you at the office. Take care.